Welcome, everyone. We are so happy you have decided to join us again today for Build Your Bones. This is our second lesson in this series. Just as a reminder, it will be recorded. If you prefer to be anonymous, please keep your video off, and you can also change your name on the screen if you would like. As always, with the University of Florida and all extension services, we are equal opportunity institutions, and we are here to serve you. So I am Marie Eric. I am from Liberty County, Florida, and I'm going to pass this over to my co-presenter today. So let's get started, people.
Yes, good afternoon, everyone. My name is Virginia C. Lopez. I am the Family and Consumer Science Agent for NC Cooperative Extension in Forsyth County. So yes, we welcome you once again. And for our second Build Your Bone session, where today we're going to be talking about screening and medications. But before we get started, I would like to ask anyone if you would care to share in the chat if you were able to set goals last week, if you'd like to share, how did that go for you? Were you able to follow through with your goals? Were there any challenges, anything you would like to share with us? Please feel free to do so on the chat right now. I'll give you just a minute for anyone that'd like to share any goals that they set from last week's session, and how did that go for you? Okay. Okay, I'm not seeing any responses. So let's go ahead. We'll go ahead and move forward. And then we have one of our co-panelists assisting with the chat. So if anything does come up, we can definitely discuss it at that point. So today we're going to continue with our conversation. And okay, I do see something just popped up, increased activity. Definitely. That was one of mine as well. So just as we're going to be building on the different steps to building on building your bones, there's one misconception that we find, well, a couple of misconceptions that is found when it comes to the disease of osteoporosis. And one of those is that many believe that this only happens to older white women, but that the contrary is truth, and that is that it happens to both men, women, and all races as well. Another misconception is that if you've been drinking all your milk since you were a little tot, when parents say drink your milk, and you have been drinking your milk, that you would not be having any problems when it comes to bone health. And again, that is contrary to that myth. It is not true. Calcium is important, as well as other vitamins and nutrients, but it doesn't mean that you will not incur any type of problems with bone health. But again, we will be discussing in the next few weeks the role that calcium and other vitamins and nutrients play when it comes to our bone health. Last week, we did learn about what osteoporosis is and the many risk factors that were associated with the disease. And this week, we're going to go and move on when it comes to screening and medications. So we're going to be learning about the methods of testing bone density and the medications and supplements that do play a role in our bone health. And so why do you think, if anybody would like to share, why do you think it's important for us to get a bone density? Please feel free to put on the chat, why do you think that is? Early detection indicates your bone health. Definitely, yes. And so When it comes to screening, it also is part of knowing your risk factors. So it is essential that, properly preventing and or treating bone loss, does play, that screening plays a role in that area. A bone density scan is the only real way to see if you have osteoporosis or if you've started to have bone loss mass. And if you wait until you actually have a fracture or other problems related to osteoporosis, then it could be not too late, but you would have a chance of having greater bone loss. So by checking the for decline in bone density sooner than later, you can start lifestyle changes that are preventative measures, and also start potential treatment before there's a greater decline. So later scans also, as you start early with your different screenings, later scans can then indicate, is there an improvement? Have you, through your lifestyle changes, is it making a difference? Is your medication making a difference? And if not, then that's where the doctor would then need to make some modifications. So again, very important to seek that early on. Our next screen, yes. So there are no universal recommendations for testing. Different medical societies have established different guidelines for testing. So when it comes to individualized approach, that is highly recommended. And so the U.S. Preventative Services Task Force recommends that all women age 65 and older consider testing. Postmenopausal women who are younger than 65 years of age also have an increased risk of osteoporosis. And so again, recommended that they consider the testing. And individuals that may be nicotine users are also added to that list. Now, we're going to be talking about oophorectomy, which is a removal of ovaries, and women who have had this procedure may not be on hormone replacement therapy. So this can be especially hard on their bones when this is happening at a very young age, which is considered early menopause. Again, whether you're a traditional smoker or someone that's using vaping e-cigarette devices, the nicotine decreases the intestinal absorption of calcium. And so the toxins of tobacco smoke affect the activity of the osteoblasts and the osteoclasts, which are cells that break down and build bone in the body. So as mentioned in the last session, age and genetic factors are uncontrollable risk factors. However, there are other risk factors that you can control. And so as part of that process, deciding when to be tested is something that should be considered as well to prevent those risk factors from increasing, and then to discuss it with your healthcare provider as soon as possible. And I think I apologize, Marie. I ended up
That's
going
okay.
past that area. So you are
That's all right.
I got
I'm
carried
gonna pick
away.
up from right here.
Thank
So
you. Okay.
as we transition over, medical conditions that can really actually affect the bones, there are very many. This is not an inclusive list here, but a number of diseases and conditions can cause what is called secondary osteoporosis. So some conditions are related to bone health, but others, maybe for instance, celiac disease and liver disease, they actually affect nutrient absorption. So that can in turn lead to you having some difficulties. And then by having that additional disease, it can in affecting your nutrient absorption, you can end up with a secondary diagnosis of osteoporosis. So you would have they would write it down as you have disease and you have osteoporosis secondary to your celiac disease, is how they put it in your chart. Some of the treatments for these diseases can affect a number of different things. Hormonal conditions may also affect your bone health. This isn't all of the medical conditions, as I said, that can cause poor bone health. But if you have any of these conditions or other chronic conditions, it's really important for you to talk to your doctor and discuss if there is a risk for bone loss as a side effect of your treatment for your conditions. So, long-term use of some medications can also cause loss of bone density. These, include some anticonvulsants, steroids, glucocorticoids, some of your corticosteroids, and cortisols or steroids. So that probably the one that everybody can see on this list that they're most familiar with would be prednisone, and it is actually a glucocorticoid. But also it's really interesting to note that some diuretics can also harm your bones, such as furosemide, and the name brand for that is like Lasix. But some of the thiazide diuretics actually do not harm the bones. So it's important to discuss your medications with your healthcare provider and your pharmacist to find out what really applies to your individual needs. We don't discuss medications really in detail, but we do give you an overview of most of the common types. It's really important to discuss all your medications with your healthcare provider. The most important thing you can do each and every appointment is to take your medications, but also include all your vitamin supplements, as well as any over-the-counter items you may take when you go to each one of your appointments. That gives your physician a true, full view of what you are actually doing each day. All right. So, other reasons for screenings. So, there are a lot of reasons that people should get tested. Osteoporosis in men is actually more likely to be overlooked by their healthcare provider. And the recommendations aren't as specific for men as they are for women. And there isn't even really a consensus on how to interpret bone density test results. So this gap has unfortunately led to men not realizing they have osteoporosis until something happens. They might have a fracture or a break, or they experience really bad back pain. In addition to reasons for testing, men should also discuss their need for testing if they have low testosterone levels or have undergone treatment for prostate cancer. So, I'm sorry. Looking at an x-ray of the spine that shows a break or bone loss might be a reason for screening. Loss of a half an inch or more of height within a year. I already mentioned the back pain, but if you have a total height loss, whether you're a man or a woman, from your highest point. So for instance, I always like to, as an icebreaker in my classes, I do in person, is I ask everyone to write down on a piece of paper what their height was when they got their first driver's license. And then we go and we measure everyone's height and we see how much height they have lost as they have aged through the years. So if you have a total height loss of 1.5 inches from your original height, then that is an indicator that you need to be screened. So be proactive and take advantage of your annual physical every year. But when they bring you out of the waiting room and they put you on the scale and they look at you and they say, "Can you tell me how tall you are?" Ask them to measure you. That is the most important thing that they can do for you that day. You pay for this service, go ahead and get it. That way you can do this annually. Make sure you do it with your shoes off each year. And then that way they have a record in your medical chart of what your height was from that day to the next year. And you can compare that to see if you also have any height loss. So we have all these different types of DEXA scans. The only way to find out you have osteoporosis is actually through a bone density scan. Normal x-rays don't measure your bone density. This scan measures the amount of minerals that are actually within the bone. If a bone demonstrates osteoporosis on an x-ray, you already have osteoporosis. If you've ever seen your x-rays, your bones should be a really bright white. If they have a gray, darker hue to them, then that is an indication that your bones are suffering from some mineral loss. There are several types of tests that are available, and all of them are painless. I can promise you that. They're non-invasive. It's very low radiation exposure, and so they're very simple to do. However, not all bone density screening techniques provide a consistent, accurate diagnosis of osteoporosis. So there are, for instance, this is a PDEXA, and that's the one where you actually, they check the density in your heel. And so you just sit in a chair and you place your foot on that and little pad there, and it does its little scanning. It's very quick, doesn't take long at all, but it's just one that they use more likely at like a health fair it's like a pre-screening kind of tool. But the most common one is called the dual energy X-ray absorptiometry, or a DEXA scan. And the test uses low levels of X-ray. As I said, it's painless, it's non-invasive, and it's generally looking at the hip and the spine. So it'll look at the hip joint and then the head of the femur, which is your leg bone, and then it'll look at the lumbar spine. So the level of radiation is really literally comparable to less than 2 days normal exposure of natural background radiation. It's even less than like taking a flight to Europe. So it's a very safe test. I used to do them myself. I was not required to wear a film badge. That's the thing that you see all the technicians wear in the X-ray department that measures their radiation exposure. That's how safe this test is. So screening or peripheral tests are used to determine if further testing is needed. So you might get that little heel test at a health fair, and they might say, hey, you might want to go take this to your doctor for further testing. So if it suggests you have osteopenia or osteoporosis, then go talk to your healthcare provider. It's a great screening tool. So overall, the DEXA scan is going to be the one that's going to give you the definite diagnosis. Other tests that your healthcare provider might order to identify possible causes of bone loss, if they need to, they could draw blood calcium levels and check for hypocalcemia, which is low levels of blood calcium. They can do a 24-hour urine calcium measurement. They can test your thyroid function. They can check your parathyroid hormone levels, testosterone levels in men, and then the 25-hydroxy vitamin D test. And that's to determine whether the body has actually enough vitamin D. So if you have decreased vitamin D level, that's directly correlated to the absorption of nutrition and your nutrients in your, including your calcium in your intestines. So too much parathyroid hormone causes bone loss, but giving parathyroid hormone as a drug, such as Forteo, builds bone. Kind of confusing, isn't it? So if you have a low level of the hydroxy vitamin D as determined by a lab test. Your physician may prescribe you vitamin D and calcium supplements, or just a prescription dose of vitamin D with or without calcium. Um, each person is an individual and it's dependent on your personal needs. So we're back over here to this DEXA scan. And it is the gold standard of bone density test, and it's the most widely recognized. Although the bone density can be measured at any spot, because the arm that you see over that patient can actually go from one end of the table to the other, they do choose the lumbar spine and the hip joint, right by the head of the femoral leg bone. So the scan determines two different scores. One of them is called a Z-score and the other is called a T-score. And it uses that low dose of the radiation. So it's maybe a tenth of the dose of a chest x-ray. The bone densitometry uses DEXA, involves lying on a padded surface with a pillow under your head. So for the hip scan, they would actually put a little triangle between your two ankles and have you point your toes in. They use little Velcro straps to try to keep your feet in place to hold your legs still. And then they would scan one or both of your hips. So once they have finished that scan, they would actually, as you see in this particular image on the screen, have you lie flat on your back, and they would put a foam block under your knees. And that just flattens out the back just a little bit more so you can get a better view of the lumbar spine as you do the scan. So each scan takes anywhere from 5 to 10 minutes. That just depends on you, your size, your body habitus, which is, are you a thick person, a thin person? And each machine works just a little bit differently. So some do take longer than others. It's no discomfort, no injections, and no dyes. That's the bonus, right? So let's talk about those scores that you get. So a T-score of 0 means that you're normal. So anywhere from, if you're looking at this slide, from a +1 to a -1 is completely normal. But if you get to that -1 to a -2.5, that is going to give you the diagnosis of osteopenia. If you go -2.5 and even lower, then that's osteoporosis. So in general, every one standard deviation below 0 indicates 10% decline in bone mineral density. So this loss of the bone mineral density is associated with an increased risk for bone fracture. So according to the World Health Organization, severe osteoporosis is defined as a bone mineral density of less than -2.5, and there has been one or more osteoporotic fractures. All right. So the low bone mass, or the osteopenia, as we said, that T-score of a -1 to the -2.5 means a person has a low bone mass, but you don't have osteoporosis yet. So if you are diagnosed with osteopenia, now's the time to really start taking action. Take those steps to improve your bone mass. Studies show that more than half of the fractures in postmenopausal women occur to those with osteopenia rather than those with osteoporosis. So a physician may start preventative treatments at this time, which would benefit you. So remember, there are certain things that we can do and certain things that we cannot control. So heredity is one of those things. Osteoporosis runs in my family. There is nothing I can do about it, but I can be proactive. I can be active. I can do weight bearing exercises, and I can take supplements. And those are things that I share with my physician. So always be really open. Talk to your doctor. You're paying for their time. Use it to your benefit. So more about this osteopenia. So in this Build Your Bones curriculum, we are promoting the idea that you are never too old or too young to actually improve your bone health. If you have been diagnosed with osteopenia or osteoporosis, there are steps you can take to prevent or slow further bone loss. So physical activity and diet are modifiable factors that influence your bone health. Medications and supplements are also available to improve that bone density. So get yourself into a good exercise routine. Make it something that's enjoyable for you, but it can make a really big difference. Small changes over time really make really big improvements. So when to start treatment? So healthcare providers don't always agree on what T-score to start treatment for osteoporosis. Some doctors may use a T-score of that a negative 2.5 or less. But the T-score isn't actually the only consideration. The diagnosis may be based on hip fracture or a vertebral fracture or other fractures with existing low bone mass. So the diagnosis may also be based on your FRAX score. And this FRAX tool actually uses information from your bone density test and then other risk factors for breaking a hip and other major bones over a 10-year period of time. So the tool is used by some healthcare providers to help them make treatment decisions for people with low bone density or postmenopausal women and men over 50. The recommendations will take into consideration other risk factors such as your family history, or if you have a history of fractures, low body weight, maybe you weigh less than 125 pounds, glucocorticoids, and maybe even alcohol intake. These are all things that they will look at. So, there are a lot of different things that can be taken into consideration. So, in postmenopausal women, therapy really is going to be based on mostly the bone mineral density and your risk factors. So here are some of the recommendations, and this is the National Osteoporosis Foundation on when you should start a pharmacological treatment. So individuals who have had a hip or vertebral fracture in the back, then that would be a good reason for them to be put onto some type of therapy or to be scanned and then taken from there. Obviously, those that we've talked about with the negative 2.5 and below DEXA scan T-score. And then the postmenopausal women and men that are over the age of 50 with osteopenia and a 10-year hip probability. And again, this is the FRAX tool of greater than or equal to 3% or 10-year major osteoporosis related fracture probability of greater than or equal to 20%, and that's on the FRAX tool. So this FRAX tool that I have been referring is an osteoporosis risk assessment. And as I said, it's a 10-year probability of a fracture based on computer modeling. You know, that's our world today. We have all the computers in the world in front of us, and they can spit out a whole lot of more information than we could ever imagine. So different models will use different areas to determine different things. So for instance, depending on maybe your age and your race and your bone structure, you may be looking at a different model. And again, it talks about areas of the world. So depending on individual results, the information may be used to guide your treatment decisions. All right, so goals of therapy. So obviously, what do we want to do? We want to maintain our health. So we want to prevent fractures. We want to minimize bone loss. We want to preserve the integrity of our skeletal structure, right? We want to have that high quality of life. We want to avoid adverse events. I don't want to go outside and trip over the sidewalk and, fall and crack my wrist as I go to brace myself. So you want to be able to decrease any negative outcomes there. So discuss your specific concerns with your healthcare provider. I think that's probably the most important thing you can do. Many of the common reasons for medications now include to prevent fractures, minimize the bone loss, and to help with those adverse events. If you went outside and tripped, maybe you get up with a bruise versus a cracked bone. It's important to remember that osteoporosis negatively affects our quality of life, and it can cause pain and fear of the fall cycle and falling and fracturing a bone or breaking one. So therapy and education and knowledge can be your power to really help you combat this and maintain your quality of life. So medications, we don't have a ton of time to devote to this, but for each and every person, this is an individual choice for you with your healthcare provider. And depending on your test results and your fracture risk, your healthcare provider will may prescribe you medication that could, help slow or stop bone loss or possibly rebuild some bone. So there are several factors that may influence what is prescribed. That's sex, age, and whether you've gone through menopause or not, the severity of your bone loss, your fracture risk, goes back to that FRAX tool, and existing health problems. Not all medications are approved for men, and all medications have potential side effects just across the board. Taking an aspirin can have a side effect. So it's important that you really discuss your options with your healthcare provider. So, the bisophosphonates. So these are your Fosamax, Actonel, and Beniva. So these oral bisphosphonates, sorry, today is not a good speaking day for me, are the most prescribed medications. These are the most common ones out there. But there has also been concern in recent years of potential damage to the bone in the jaw with prolonged use of these type medications. So there have been several studies going on about how long you should take these medicines. They can be very effective, so it's important to weigh the potential benefits with the less likely side effects. It's also a good idea to review your medications annually with your healthcare provider because, again, that can help them to determine, is this the appropriate medication for you, or do you need to change to something different? So the oral biphosphonate instructions are really specific. And so it's one of those that you would take first thing in the morning. You take it on an empty stomach with a full glass of water. And then you avoid food and you must remain sitting upright for a minimum of 30 minutes and a preference of 60 minutes. It's one that they are very cautious of using with people that have heartburn or stomach or esophageal ulcers. You can't take it if you're pregnant or if you have poor kidney function. So it is very important to take this as it is prescribed, and just be aware that it can have some side effects. So in general, most people don't have any issues with these medications. Again, it's one of the ones that is most widely used. So, that has to say something, doesn't it? So, they also have injectable versions. So that would be your Reclast and your Beniva. So if you don't want to do the oral forms, or if, if it's determined by your physician, it might be best for you to do these injectables. That is an option. Those people with problems such as, we said the acid reflux, and they have something that's called Barrett's esophagitis. And then those with stomach ulcers and difficulty swallowing. You could do the injectables or the intravenous options that are available of these. So the Boniva is an injection. It's every 3 months. It's just a quick IV injection. It doesn't take long at all. The Reclast is the IV infusion, and it takes about 15 minutes, but it's actually a once a year deal. They do pre-treat people mostly using Tylenol just to reduce a risk of any kind of acute reaction. I'm not familiar enough with that particular medication to be able to even say what that reaction would be. So, that again would be something you would need to discuss with your healthcare provider. So, hormone therapy. And if you remember in the very beginning, we talked about those who had had the oophorectomies, the removal of their ovaries for whatever reason. Um, if that is done at a very young age, they call that post-ablative menopause. So one day you're 25 years old, and then you have this surgery for whatever medical reason, and then all of a sudden you don't have that estrogen in your body any longer. You don't have your ovaries. So, if they will give you some hormone therapy a lot of times, to help minimize the risk of bone loss. So that's really important, during our childbearing years as women, because our body does produce that hormone estrogen. But at menopause, or if, you had a hysterectomy or the oophorectomy, then you don't have that any longer. So if you go through natural menopause, that estrogen level drops naturally, but it could also happen with a surgical issue. So that loss or drop in estrogen can contribute to bone loss. So hormone replacement therapy is a really good way to combat that. The recommendations are now lower doses for shorter periods of time if possible. So again, this is all very specific to you and to your health. So always consult your healthcare provider, but hormone therapy is really good. It has been shown to reduce bone loss, increase bone density in both the hip and the spine. But again, it can increase other health risks for certain people. So, those are the things that we have to weigh as patients and decide what's best for us. So now we are on to the serum elective receptor modulators. So that's the SERMs. And this is like your Avista. So it's a raloxifene. And it is mimics what some estrogens positive effects without some of the problems that come along with hormone replacement therapies. So it is good in some postmenopausal women, and it can aid with reducing the risk of vertebral fractures. It's a 60 milligram tablet that's taken daily. But it does come with side effects. You might end up with the hot flashes, you might end up with some leg cramps, and it does have an increased risk of thrombosis. And so that's where you might actually end up with some clots. So again, this is where we go when we think about, what our risks are and what we choose to use and choose not to use. So you need to pick what is right for you. And that's a conversation for you and your physician. So we're going to finish with the miacalcin and the Forticol. So this is the calcitonin and is approved only for the treatment, not prevention of osteoporosis. It slows bone loss and has been shown to reduce risk of spinal fractures. It can be injected or administered through the nasal spray. The side effects are reduced if you use the nasal spray versus the injection. So it's either going to be the daily nasal spray, and they would tell you to use that in one nostril and then alternate, and the next day use the other nostril. And then the injections would either be daily or every other day. So if it does have a few side effects. If you are allergic to allergic reactions to salmon, it can increase risk of malignancies. If you use the nose spray, then people complain of runny nose and things like that. So, all right, I'm going to turn this back over to Virginia because I think I actually went over.
It's okay. You were doing fine. I was like, if she doesn't catch it, that's fine. No problem. Okay. So let's see. For Teo, yeah. So it's also an approved treatment, not for prevention of osteoporosis, but it is available for men and for postmenopausal women. This is a synthetic version of the parathyroid hormone. That helps to build bones, as opposed to some medications that actually slow the rate of bone loss. This medication is injected daily, and the current recommendation is that treatment should not exceed a 2-year period. Next slide. Prolia is also another approved treatment of osteoporosis for both men and women. And it isn't approved for prevention. And this one is taken, generally it's taken every 6 months, and it is through injection. Next. Okay. Then we have our non-pharmacological treatments. Although medical interventions may be recommended for low bone mineral density, lifestyle modifications that we will be discussing throughout the series can also be bone protective. And these will include fall prevention, proper nutrition, supplements if they're needed, multi-component exercise program, smoking cessation, alcohol moderation, and decrease of caffeine consumption. So next week we're going to start our discussion on nutrition for general health and bone health, as well as supplements. So as we're nearing our closing, we want to leave you with some ideas to consider starting for your steps to better bone. So some of these ideas for, to consider your goals for this week. So you want to look at your personal risk for osteoporosis, which we provided last week. And look at what risks you can change. Like talking to your health provider about the risk, as well as medications and supplements. And then remember that building stronger bones doesn't happen overnight. So we need, like Marie mentioned, being consistent, especially when it comes to the physical activity. During the rest of this class, we'll focus on steps that you can take and provide you with tools to build your bones. And next time we'll be learning about eating tips to build and maintain your bone health, as well as supplements. So as we are coming to a close, next slide, please. So as we summarize, we discussed, we encourage you again to discuss your concerns and any potential fracture risk with your health provider. Determine if you should have a bone density test. and based on your health provider's recommendation, work together to create a plan to maintain or improve your bone health. Again, lifestyle changes play a big part in bone health, but medications and or supplements may be appropriate. And again, at the recommendation of your doctor. If you do take the medication, then again, be sure to follow the directions to make sure that you are getting the maximum benefit of that. Next. 33, okay. So, it's time for us to start setting goals. So, we talked about medications, we talked about screening, the importance of the bone density screening for some of individuals. So would anybody like to share how you will apply what you learned today towards towards your overall bone health? And feel free to just chime in on the chat there. And we'll try to address some of these questions in just a few minutes. But anyone, any goals that you would want to set for this week?
Sometimes it's really kind of hard when you're starting out, but maybe it could be as simple as how many servings of calcium am I getting a day? Maybe are you drinking a glass of milk each morning or having some yogurt? Try to assess what it is that you're actually taking in, and then maybe you can move toward figuring out what the barrier might be to you actually doing that. Do you dislike milk? Or is it because you get your calcium and ice cream and maybe you need to swap to a low fat yogurt or something like that? But you know, just a few thoughts. So I'm gonna stop sharing my screen. Okay. All
So
right.
we do have, Marie, quite a few questions.
I see there are lots of things in there. So where are we starting at, Melanie and
Let's
or
see.
Beth?
So the ones that we haven't answered in the chat would be about the one with Nancy about, do biophosphonates work by A, building bone mass, or B, slowing rate of bones loss, or C, both? As she heard that I can't even say it
Divinity
today.
builds bone
Divinity.
mass.
Yeah, that one.
I am not familiar with Avinity, but the biophosphonates, and it just depends on which one you're looking at. And let me go back and look and see which ones she might be talking about in specific, but we can so they really, I'd have to go back and look it up, and I would prefer to look that up before I answered it, but I can most definitely do that. And either bring it back to the next class, because I'm really not, I don't think I've ever seen the Avinity. So I would be interested in it as well.
So the next one that we haven't answered was, why would the T-score be compared with a 30-year-old rather than a person my age, which is of 80?
So because that's the age of your peak bone mass, ideally. Each person's peak bone mass, it depends on if you're a male or a female, obviously, or whatever, but is around that age frame. So that's when you should have had your highest bone mass. And so if it's the way their math problem, I'm not a math person. That's why I always love that the little machine printed it out for me, but that's where that all comes from. That's how they look at it. That is your peak level of bone density, ideally in your life. Therefore, that's why you get compared that way on a T-score.
It sounds like we would have to have like a focal point, a starting point to be able to do that comparison, right? Whether you're 50 years old, 60 years old, always going back to that one, like you mentioned, that peak bone mass.
So, and the other thing is, I want you to think about this. If you are a 80-year-old person and you're being compared to all the other 80-year-olds, well, they probably have low bone density as well. So you want to be, the T-score is designed for if you are in the normal range, you're optimal
Mhm.
and you compare to a 30-year-old. But if you're not in that range and you have osteopenia or osteoporosis, then that's why they do that.
We have a lot of great suggestions in there, Marie, of what the people are going to work on this week, which is awesome. I'm so excited about the accountability. I have one more question. It says, do you need a calcium supplement if you use dairy products every day?
That is a question for you to have with your healthcare
Mhm.
provider, because you may take in what you feel is adequate amount of calcium, but it does not guarantee that you are always absorbing everything that you bring in. If you have digestive issues or intestinal issues, for instance, if you had Crohn's or something like that, that prevents some of the absorption. So that could be a problem. So that would be something I would discuss with my physician, and they could do one of those lab tests that we discussed earlier, and they could see if you feel like you are, or what you're taking in is adequate for what your needs are.
Marie, just to make sure regarding the rest of the questions, I think we have answered in the chat. However, people had requested seeing something back on the slides. And if I remember correctly, they're going to have access to the recording. So they would
They
be able
will.
to look back over it. So that is something that if they want to if you felt like the slides went too fast, you have the opportunity to revisit that and rehear that at whatever speed or that you need to.
Okay.
And otherwise, I think we've answered all the questions.
Actually,
Oh, no,
Beth,
that's not true.
Beth, there was one person I think that asked about recommendation on physical activity. They asked what is a good amount of time I should do each day. So to answer the question, the minimum requirement, that's recommended by PAGA, which is the physical activity guide for Americans, is 30 minutes a day for 5 to 6 days. Can you do more? Definitely. As far as strengthening activity, they recommend anything from 2 to 3 days per week. Targeting different areas of your body. So like one day you could do upper body, another day you could do the lower body parts, and so forth. And of course, walking is one of those great weight bearing exercises. Each time you take that step, as you're stepping down, that you're creating that bone and muscle to strengthen. So definitely want to include as far as cardio is concerned. But the weight bearing, either doing bands or weights, or using your own body, like doing push-ups, is a great one as well. Any other recommendations anyone out there would recommend that you already do that would also can add to this?
Thank you so much for catching that one. I just wanted to say we did have one more come in, is what is recommended limits on the timeline for a patient to be on Rezidronate? And I don't know that I have the answers for that one, Marie.
So again, that's going to be a depends on why it was prescribed to you. And it's used for not just osteoporosis, but like if you have Paget's disease. So that's very specific to you. And that's something that you and your physician have to determine. So I couldn't possibly, we're also individual. If I were to take aspirin and I gave one to Virginia, how it affected her and how it affected me could be two worlds apart. So that's why we probably say it over and over and over again. It's really important for you to take everything with you, including your supplements, any over-the-counter medicines, and your prescription medications each time you go to all your appointments. If they are going to hand you and say, hey, well, let's add this to your regimen, that's your primary opportunity to drop all of those bottles right in front of it. Is that going to be safe for me to take with all of these other things that I am currently on? And that puts out there everything you're taking as a supplement and as a prescription. And that's really the best way that you can really do that. There's another one that dropped in here about the negative effects on tooth care, and that's the jaw thing that we were talking about earlier with those bisphosphonates. Again, that's where you weigh the benefits and the potential side effects, and that's something that's very individual to you. They have been looking at that, they've been following that more with studies, but everything is very individualized. But we are here to provide as much information as we can. We love to impart knowledge. Ours is all research-based. We don't go just grab it out of thin air, and that's what makes extension special when we do these things. So we want to arm you with as much information as we can for you to go and give your doctor a headache. That's what it's of it.
Marie, we have one participant that says that they will be checking in with their doctor to see when they're how long ago they did their last DEXA scan. So that is a great goal to set. Is just making a phone call, right? And doing a follow-up with the doctor if it's been a few years, definitely. So we encourage anyone else out there that has either not had one or has had one to reach out to their medical provider and get some of these questions answered and do your screening.
Absolutely. Well, we will hang out here for a few more minutes, but we really thank you guys for joining us today. We always enjoy these.
And we hope to see you guys next week when we're going to be now going into more of our nutrition portion. That is that is something that you have control. So next week is eating tips for your bones. So please join us live if at all possible. Thank you.